Hi guys, so let's start with the question of the day. The question goes like a 3-year-old boy presents with his mother to orthopedics department with widening of wrist and ankle, chest prominence, prominent costochondral junction. On blood examination, you will see which of the following: A. Increased calcium, B. Increased phosphate, C. Decreased PTH, or D. Decreased ALP. So this is a very easy question. It comes from both the subjects, that is pediatrics and orthopedics. So one question you will always get from metabolic bone disorders. First you will try to answer this yourself. First let's start with highlighting the keywords. Widening of wrist and ankle. This is giveaway for the question. Chest prominence. Prominent costochondral junction. So all this is telling you about rickets. Rickets, it is a counterpart of osteomalacia. Osteomalacia occurs in adult and rickets occur in children between 6 months to 3 years of age. Now what you will need to know about rickets. Why rickets happens? It is due to calcium deficiency, phosphate deficiency, or vitamin D deficiency. It could be nutritional deficiency, malabsorption, some liver or renal failure, lack of sunlight exposure, and there's something also known as rickets of prematurity. What is rickets of prematurity? It means because majority of the minerals we get from the fetus gets is from his mother, which is transferred during the third trimester. So if the child is born premature, the child can have rickets at birth. So this is one additional point, rickets of prematurity. Now this is an INICET PYQ. Which layer of the growth plate is affected in rickets? It is hypertrophic layer of the growth plate. It is a mineralization or a qualitative defect. It is vitamin D deficiency. From D you can learn it has a dual effect on calcium and phosphate. It reabsorbs both of them. So that is why in rickets both calcium is also less and phosphate is also less. Now what are the clinical features? First it is skull. Skull, you see craniotabes, that is soft ping pong skull. Delayed closure of fontanelles is there. Usually you all know that anterior fontanelle closes by 2 years. So there will be some delayed closure of the fontanelle, and frontal bossing is also seen. From just I remember ping pong skull. We also study about ping pong skull in forensic also. You will tell this in me in the comment section. What is that? In chest, you can see rachitic rosary, that is round, smooth, and non-tender. But the rosary which is found in scurvy, it is sharp, it is tender. What is pectus carinatum? Pectus carinatum means prominence of the sternum. So it is a chest wall deformity with overgrowth of cartilage between the ribs and sternum. You can also see Harrison sulcus, a depression along the subcostal margin which occurs due to the pull of the diaphragm. Long bones, you can see bowing, splaying, and fraying. These two images have been repeatedly asked in your exams. So you can see cupping. You can also see splaying. What is splaying? Splaying means widening of the bones, and fraying. In knee you can see genu, varum, valgum, both can be seen. What is windswept deformity of toes and windswept deformity of legs? In legs you can see it in rickets, and in toes you see in rheumatoid arthritis. So there in teeth you will see some enamel defect in rickets also. So this is about rickets. But the question is asking about the blood examination. So no, there will be decreased calcium, decreased phosphate. Now what is PTH and ALP? PTH is parathyroid hormone. So what is the function of parathyroid hormone? This is a very nice image. What this parathyroid helps in bone? It causes bone reabsorption. Parathyroid causes increased calcium in serum. So in rickets already the calcium is low. So there will be increased parathyroid in our body, not decrease. So answer automatically even by rule out becomes decreased ALP. So what does parathyroid do? Parathyroid, it increases the calcium but it decreases the phosphate. So it inhibits phosphate reabsorption, and calcitonin just does the opposite. So parathyroid, it increases calcium but it decreases phosphate, and calcitonin it reverses it. At what is ALP? ALP is alkaline phosphatase. So ALP, it is increased in rickets. So answer becomes D. So this is a very easy topic, very easy question, which you matlab, get in your exams. And vitamin D deficiency, what is vitamin C deficiency? It is scurvy. And in scurvy you will have some keywords like perifollicular hemorrhages and bleeding gums, like this. So very easy question, easy topic. Thank you guys, see you tomorrow for with another question. Thank you.